So let's study Agadatantra MCQ Part 2. Question 25. Pinpointed pupils are the toxicity feature of AHIPHENA. So let's study some important points about opium. Opium is a dry juice of the white poppy, that is a Papaver somniferum, when the capsule is still on the plant. It is dark, brown or black, and has a peculiar smell and has a bitter taste. Poppy seeds are white, harmless, demulcent, and nutritive and are used as food. So active principles are about 25 alkaloids and major ones being phenanthrene, morphine, codeine and thebaine, and isoquinoline, papaverine, narcotin and noscapine. Fatal dose is 2 gram morphine, 0.2 grams, codeine 0.5 gram. Fatal period 6 to 12 hours. Clinical picture. There are 3 stages. One is stage of excitement and euphoria, and there is increased sense of well-being, increased mental activity, flushing of face, convulsion are seen in children. Stage of stupor, headache, nausea, vomiting, giddiness, lethargy, drowsiness, contracted pupils, cyanosed face, and itching all over the body. Stage of narcosis, deep coma, muscle relaxed, areflexia, pinpoint pupils, not responding to light, hypertension, sweating, hypothermia, cyanosis and froth at mouth and nose. The triad of coma, pinpoint pupils and deep respiration 45 per minute strongly suggests the opium poisoning. So opioid overdose triad is a combination of 3 signs and symptoms that indicate an opioid overdose. Pinpoint pupil, also known as pupillary meiosis, unconsciousness, that is drowsiness or decreased level of consciousness, and respiratory depression, also known as hypoventilation or slowed or stopped breathing. Treatment is the gastric lavage, even for injected morphine as it is excreted in the stomach. Enema purgative, high tension oxygen and chloramine as cardiorespiratory stimulant. Symptomatic treatment, antidote is naloxone 1 to 2 mg IV every 5 minutes till the patient become conscious and pupils dilate. 26. Dash is a toxic principle present in AHIPHENA. It is morphine. And opium has 25 alkaloids divided to 2 groups, that is the phenanthrene derivatives and semi-synthetic opioids. Phenanthrene derivatives means main narcotic constituent. It contains a natural alkaloids, morphine, and 10% white color powder, bitter taste and alkaline in nature, and also codeine 0.5%, thebaine 0.3%. Semi-synthetic opioids are they are produced by chemical modification of an opiate and include hydromorphone, diacetyl morphine, that is a heroin, brown sugar or smack, oxymorphone and oxycodone. Also, the synthetic opioid. These substances are not derived from an opiate but binds to an opioid receptor and produce the opioid effect clinically. It includes a methadone, fentanyl, pentazocine, tramadol and meperidine. Benzyl isoquinoline derivative, no significant CNS effect, 1 papaverine 1% and 2 noscapine 6%. According to Reza Tarangini, VATSANABHA is a dash visha. It is a kanda visha. Dirgha moolam, stula kandam, Vatsanabhi visha kshubam, utpadya, shita samaye, vasande va samahareta. Postmortem finding showing combination of intense lividity of the face, approaching blackness, and edema of the lungs are the hallmark of dash poisoning. It is opium poisoning. So postmortem lividity or the liver mortis in hanging, it will be discoloration in the distal parts of hands and leg. H2S, that is a hydrogen sulfide poisoning, bluish discoloration, carbon monoxide poisoning, cherry red, cyanide CN, bright red, opium poisoning, black, aniline chocolate brown, and phosphorus dark brown color. Exuding milk is collected from dash of Papaver somniferum. It is collected from the unripened poppy capsule. In opium poisoning, wasting limbs and diminution of sensibility is initially seen in stage of stupor or depression. In this stage, the victim presents with weariness, weakness, headache, giddiness, heaviness in the limbs, urge to sleep, itchy skin and constricted pupil or pinpoint pupil. Hemp insanity sometimes result after the chronic intoxication of banga. Hemp insanity term given by Dunichiboy for cannabis psychosis in 1930. This is characterized by acute schizophreniform disorder, disorientation, confusion, and has a good prognosis. And bung is an edible preparation made from the leaves of cannabis plant. Frenzy decide on part of the victim of killing any person against whom he may have false or real enmity is called as run amok. This is a psychotic disturbance usually seen in chronic cannabis users or even first-time user of cannabis. This is characterized by eager desire of the person to commit murder. He first kills the person against whom he have an enmity and kills anyone who come in the way until the homicidal tendency lasts. Then he may commit suicide or he may surrender himself. Which of the following is not an abuse preparation of banga? Common forms of cannabis include herbal cannabis, marijuana, bhang, ganja, charas, hashish oil. So the abuse preparation, not an abuse preparation, is AFIM. AFIM is opium. Poppy, Efim, Kazumba or Madak Chandu is derived from Papaver somnifera. Which of the following active principles is responsible for the psychoactive effect of banga? It is tetrahydrocannabinol. Cannabis is a complex plant with over 400 chemical entities, of which more than 60 are cannabinoids. Delta 9 tetrahydrocannabinol THC is a major psychoactive. Non-psychoactive is cannabidiol, that is CBD, and cannabinol. Injection methadone is used as a drug of choice in the treatment of morphinism. Methadone injection is also used together with the medical supervision and counseling to treat opioid addiction, for example, heroin or other morphine-like drugs in patients who cannot take oral medicines. Methadone is an opioid analgesic or pain medicine. It acts on the nervous system to relieve pain. Usual fatal dose of opium is, answer is option A, 500 mg. Crude opium, fatal dose is 500 mg. Morphine, therapeutic dose is 10 to 15 mg, but fatal dose is 200 mg. Codeine, therapeutic dose is 10 to 60 mg, whereas fatal dose is 800 mg. Heroin is the fatal dose is 50 mg. Which of the following Vishadravya does not come under NDPS Act? So what is NDPS Act? It is a Narcotic Drugs and Psychotropic Substance Act 1985. And the Dravya not included is tobacco. So which are the commonly abused substance not covered under NDPS Act is bunk, tobacco, alcohol, gudka masala, thinner, ointments. Dash is the active principle present in Jayapala. It is croton. Active principle of Jayapala or croton tigillum is crotin or croton, a toxalbumin which is an irritant and vesicle. A less poisonous glycosid, crotonacid, is also present. The activity of the croton is a vesicant externally and as a purgative internally. Which of the following is a plant irritant poison? It is Jayapala. So, plant irritant poisons are Eranda, Jayapala, Guncha, Chitraga, Arka and Balladaga. An irritant poison are substances that cause inflammation or irritation when they come into contact with the body issues, particularly affecting the GI tract, skin or respiratory system. Symptoms of irritant poisons include severe pain, vomiting, diarrhea, difficulty breathing, skin redness or blistering depending on the route of exposure. Irritant poison can be widely classified into organic, inorganic, mechanical. Organic, again, vegetable animal, vegetable croton, castor, calotropis zebrus, animal, snake venom, scorpion venom, inorganic, metallic, non-metallic, metallic, lead, arsenic, mercury, silver, non-metallic, zinc chloride, ferrous chloride, phosphate, sulfur, nitrate, and mechanical, powdered glass, diamond dust, and chopped hair. Postmortem appearance. Changes chiefly in stomach and frequently in duodenal and rectal portion of the intestinal tract. Antidotes used are antidote for irritant poison vary by its type. BAL treats heavy metal poisoning like mercury. Atropine is used for organophosphate and antivenoms counteract animal toxin. Activated charcoal is often given to absorb ingested poison. Which of the following drug is mentioned in Charagokta Vishakna Mahakashaya? Answer is option B, Suvaha. Haridra Manjishta Suvaha Sukshma Ela Palindi Chandana Kadaga Shirisha Sindhuvara Sleshma Adaga Idi Dashemani Vishagnani Pavanti. So Vishakna Mahakashaya include Haridra Manjishta Suvaha Sukshma Ela Palindi Chandana Kadaga Shirisha Sindhuvara Sleshma Adaga. According to Gangadhara Tika, the Sthavara Visha Gadi is Jangala Visha poison is Urdhva Gadi, Sthavara Visha Adho Gadi. So answer is option D, Adho Gadi. According to Charaga, one of the Hedu of Shodha is Balladaga. Tatra Agandava Chetana Pedana Kshanana Banchana Pichana Utpeshana Prahara Vadha Bandhana Veshtana Vyadhana Pidanadi Bihiva. Common etiological factor of Agandaja Shodha are Chedana or excision, Vedana or incision, Kshanana churning of bone, Banchana breaking, Pichana excess squeezing, Utprashana grinding, Prahara hitting, Vada stroking, Bandhana binding, Veshtana twisting, Vyadhana piercing, Pidana pressing, etc. Balladaga Pushpa Falarasa, Atmagupta, Shukra Krimi, Shuga Hida, Patra Ladha Gulma Samsparshane Hiva. Svedana Parisarpana, Ava Mutranai Hiva, Vishena, Sa Visha Prani Damshtra, Danda Vishana, Nagha, Nibhadehiva, Sagara Vishavada Himadahana, Samsparshehi, Va Shodaha Samubachayante. So in addition to these traumas, some other factors such as coming in contact with the rasa or juice of pushpa flowers or pala fruits of some plants such as balladaga, atmagupta or shuga, krimi, shuga hida, that is getting bitten or stung by certain insects or sansparshane hiva, touching irritant patra leaves, ladha climbers, gulma shrub, Svedana, sweat or mutranai hiva, urine of Parisarpanava Vishena, poisonous animal. Savisha Prani Damshra, or even coming in physical contact with them. Danda, Vishana, Nagadibadaihiva, or getting injured by their teeth, horns, nails. Sagara, Vishavada, or exposure to marine or poisonous air. Some Sparshanaihiva, or exposure to excess hema, cold or dahana burns, may also result in Agandaja Shodha. According to ANUPANA MANJARI, labor of dash is indicated in Balladaga Jit, Balladajaga Nit Shodha. So that is answer is option A, Meghanada Rasa with Navanida. Antidote for Balladaga is Meghanada Rasa with Navanida. Subside the Shobha caused by Balladaga. Daru Haridra, Sarshaba, Musta with Navanida. Navanida and Tila with Sharkara. The ghee subsides. Painful condition caused by Balladaga. According to Anupana Manjari, dash is stated to be used in Dattura Vishanjita Vikara, and it is Vrindaga Falabija Rasa. Antidote for Dattura Bija is Vrindaga Falabija Rasa 1 Pala, Godugda with Sharkara, Karpasa Asti and Pushpakwada with Levana. So the antidote, let's see some antidote mentioned in Anupana Manjari for UPAVISHA. Snuhi and Arkakshira, local application of Chinchapatra triturated with water, intake of Suvarna Ghairika with Jala. Dattura Bija, Vrindaga Falabija Rasa 1 Pala, Godugda with Sharkara, Karpasa Asti and Pushpakwada with Levana. Karavira, Mahisha Dugda or Mahisha Dadi, Arkatvaja powder with water. Vijay Banga, cow's curd, Shundi, fresh root of Sandeshada, triturated with water, or administration of Ardraga. Vishatinduga Bija or KUPILU, repeated continuous consumption of ghee along with Madhu, Sharkara, Rejagam or Jayapala, Danyaga triturated with water taken along with Sita, AHIPHENA, Brihat Shudra juice with cow's milk, Vaja Saindava Pippali and Madana Pala for Vamana, Tangana Tutta for Vamana, Gunja, Meghanada Rasa with Sharkara. and only Godukta. Balladaga, we already mentioned. Meghanada Rasa with Navanida subside the Shobha caused by Balladaga. Daru Haridra, Sarshaba Musta with Navanida. Navanida and Tila with Sharkara. Ghee subside painful condition caused by Balladaga. Arushkara is the synonym of dash Upavisha. It is Balladaga Upavisha. So synonyms of Balladaga in Sanskrit language are Shobhakrat. It causes inflammation on direct contact with skin. Agnika, Agnimuka. It is as hot as fire. Arushkara causes wounds during skin contact. Bhutanashana. It kills harmful microbes. Spodahetu, Shobhakrat. Direct exposure to its volatile oils can cause swelling, blisters and inflammation. Vahninama, Birataru, Kshadak Pridhika Bija and Shaila Bija Balladaga all are synonyms of Balladaga. Anaphylaxis reaction may occur with the consumption of dash visha. Balladaga is a medicinal plant in Ayurveda that can cause anaphylaxis, a life-threatening allergic reaction. Which of the following is not the toxicity feature of Dattura? It is dermatitis. So what are the symptoms of Dattura poisoning? Delirium, a state where it's difficulty to distinguish reality from fantasy, hallucination, bizarre or dream-like hallucinations, hypothermia, high body temperature, tachycardia, fast heart rate, behavioral changes, dry mouth and skin, dilated pupils, that is a severe mydriasis, muscle stiffness, urinary retention, temporary paralysis, amnesia. Datura has been used as dash poisoning. It is a stupefying poisoning. So what is stupefying agent? Those poisons which are used to stupefy or fool the person. For example, Datura and chloral hydrate are used to rob the stranger or for the commitment of other crimes. All species of Datura are extremely poisonous and psychoactive, especially their seeds and flower, which can cause respiratory depression, arrhythmia, fever, delirium, hallucinations, anticholinergic toxidrome, psychosis, and death if taken internally. Datura plants contains scopolamine, isocyamine, and ectropin. It is popular poison for suicide, murder, and is used for stupefying a victim prior to robbery, rape, or kidnapping. Antidote used in the treatment of Datura poisoning is option A, physostigmine. So the treatment for Datura poison is decontamination, that is stomach wash with potassium permanganate or tannic acid and purgative. Physiological antidote, that is a physostigmine 1 to 4 mg and is repeated at intervals of 1 to 2 hours if necessary, or neostigmine 2.5 mg IV every 3 hours. In severe cases, physostigmine, a cholinesterase inhibitor, should be used to reverse the anticholinergic toxicity. Physostigmine should be given intravenously to an adult in a dose of 0.5 to 2 mg at a rate of no more than 1 mg per minute. A second dose may be administered if necessary. Fatal dose of the Datura seeds is 50 to 100. So fatal dose is 100 to 125 seeds, and the lethal dose for alkaloid is about 60 mg for adult and 4 mg for children. The fatal period is death usually occur within 24 hours. So thank you for watching my video. For more updates, please like, share, subscribe my channel. Thank you.